Forge 103.9, a new sound. You know what, guys? It's so exciting today because the discussion that we usually do is a little bit different today, huh?
Very different.
For sure.
Not one, because we have probably maybe the only time that a vaccine is going to be introduced in our lifetime, hopefully, right?
Oh, yeah, hopefully, right?
And then
Fingers
unless it's like more like proactive, and we don't have to go through shutdowns and everything. But the other thing is that we're on Facebook Live. We are
Hi,
on
everyone.
Facebook Live. Hi, everybody. You can see us on
Live.
Facebook Live. Dr. Franco, how are you?
Good morning. I'm good. Thank you.
So we're gonna get into your medical credentials here in a little bit, but
Okay.
what we like to do on the show is we just like to ask folks a little bit about themselves. And so we understand you're from Colombia. So you were born there, correct?
I was born in Colombia with an O, not with a U.
Oh,
Colombia.
Colombia.
Oh, okay.
There you go.
I was born there. I went to medical school there. I came to the United States in 2011, and then I did my additional medical training here in the U.S. And I currently live here with my husband, my 18-month-old, and I'm pregnant with. I'm almost 35 weeks.
35
Oh, wow.
weeks. There's a lot to unpack there. So talk to us. What part of Colombia were you born in, and what was it like growing up? And what's the? I mean, there's so much. We were joking before, but Narcos doesn't paint Colombia in a nice way.
I think it's fair to say that Narcos and what happened with Pablo Escobar and all of the cartels is part of our history. Like, we can't deny it. None of us is proud of it. But Colombia is so much more. So we are a country that, as all of you know, we're in South America. So we're very friendly people. We're happy people. We love dancing. We love music. We're proud of our coffee. We're proud of our singers. We're proud of our reggaeton, our salsa, and we're proud of each other. I think we're
and
very,
your football
and on our soccer,
Your soccer.
football, which is
yeah.
football for us.
Mm-hmm.
And we're very proud of that. We didn't do very well over the last few games, but that's okay. we'll do well.
There's still time.
Yes. And in general, we care about each other. We're very strong people. We try and see the bright light, despite situations of drug in the 80s and 90s. That we've overcome that, and I think that we're happy people that like to help each other out and like to help others.
So Colombia is like a really just culturally rich country. I mean, we're talking about amazing food. Like, that's one thing. I want to take the time to talk about that, but it's definitely not even close to what Bakersfield is like. So how did you end up in Bakersfield?
So, I've trained in big cities, and in Bakersfield just happened to need an infectious disease doctor, and we have a lot of vulnerable populations. So I ended up coming here for work. But that's true. We have a lot of different food, and we have cultural backgrounds depending on the zone of the country you're from. And Bakersfield, we don't have many we don't have any Colombian restaurants here. There is a really good one that serves very vegan food that's very similar to Colombian food that I really like.
In Bakersfield?
In Bakersfield.
Which is
it's
that?
Vita Vegan.
Oh, right down the street here.
Yeah.
Yeah,
It's
okay.
owned by a Colombian, and he does really good vegan food, so I really like it.
Yeah.
But it's mostly in Bakersfield. It's mostly Mexican background, Mexican culture, which I love with all my heart. The food is way better than the Colombian food, but yeah. So there's a lot of room for bringing the Colombian culture to the city and getting that.
I got a question. So, you did your formal education in Colombia, right? What made you want to transfer out to the U.S. and come over here into this big boiling pot and just be like, you know what, I'm just going to take my whole life and come over here?
Yeah. So in Colombia, the healthcare system, in my personal opinion, it's a little broken. There's a lot of room for improvement there. You become a very good clinician. You become a very good examiner. You become very good with your eyes and ears. But a lot of times you don't have enough resources to treat the patients. Of course, it depends on the setting. If you go to the wealthy hospitals, the private practice hospitals, you have everything. But if you stay in the communities that are vulnerable, you run out of everything, and you can't really follow guidelines. In Colombia, talking about healthcare, we follow American guidelines. So I always wanted be trained and further my like graduate medical education in the country that wrote the guidelines so that I could learn and potentially, if I'm going to go back to my country, bring, fresh knowledge that it's to the letter and following the book, and maybe helping people that don't know these guidelines because they don't have the resource to follow them. So that was one of the reasons. And then I came here. I ended up, forming my career here. So
yeah, and Dr. Franco, can you walk us through like your medical journey, right? So I know that to become a doctor, there's multiple steps, right? That includes your undergraduate studies, but then you have to go to like medical school, and then even after that, there's this thing called residency, which I kind of understand.
Yeah.
And then you have and then you went to study infectious disease with like
Right.
a fellowship or something. So can you just like
Yes.
walk us through that and try to
Of
explain it
course.
to everybody in a way that we can
So,
understand?
In Latin American countries, most of them, it's a little different than here in the U.S. You have your undergrad, and then you move to medical school, which ends up being probably 4 of undergrad, 4 of medical school. In Colombia, you go straight 8 years after high school to medical school.
Oh wow.
Wow.
So it's the same time, but it's just straight out of high school. So we completed that there. And then after that, in Colombia, you become what we call a general doctor or a general practitioner.
Okay.
And then you look for a specialty. So that's when you decide to become a pediatrician or a surgeon. And in my case, I wanted to be an internal medicine doctor, which is, a lot of people say it's the pediatrician of the adult, right? So it's the easiest way to understand it. So I came to the U.S. and I went to do my specialty training. That's what we call a residency at Mount Sinai Hospital in Miami. And then after that, you become a specialist, but you want to be a subspecialist. So you can either be a primary care doctor or you can move forward to your subspecialty, which in my case was infectious disease. And I went to New York City for that.
And you're at Sloan Kettering, which is
I
a very
was.
prestigious medical center.
Yes, thankfully I was able to go and train at Memorial Sloan Kettering Cancer Center, which is probably one of the best cancer centers in the world. And I went there because I wanted to focus on the what we call the immunocompromised host,
Mm-hmm.
which means all those folks that have either cancer or undergoing bone marrow transplants, and all your immune system goes down and you get infected with all sorts of crazy things that you wouldn't normally get if you had a healthy immune system. So it was a very special kind of training, and that's why I went to a cancer center for that.
So coming from Colombia, right? Did I say that
Yep.
right?
Yes.
See, I was
Nice.
practicing in my head. You guys may think I wasn't gonna ask questions, but I had to make sure I got my Latin voice out, right? It must be a culture shock, right? Like New York, everything's so big, busy, and just how did you adapt in there? Because I mean, that's a story in itself.
Well, both cities have a lot of Colombians. Actually, the New York City has the largest number of Colombians outside of Colombia.
Wow.
So it was not that of a shock, honestly. I found everything, all my food, all my music, all my friends, and like a lot of people were Colombian, so it was not a shock. Now here in Bakersfield, it was a little bit more of a shock because then I became more Mexican, which I love. But so you adapt in a good way. I think that your Colombian things become useful here. So, for example, speaking Spanish is very useful. Understanding the Latino culture and how they think, how they feel has been, a plus. So adapting was very easy, honestly, to just, the U.S. is full of Latino culture everywhere. So adapting wasn't that difficult.
Okay, I see.
So during kind of when you were talking about your career and all the steps that you took to get to this point, you mentioned Miami in there.
Yeah.
So I want to know a little bit about, I knew you were training there and you were busy being a doctor, but did you go out?
Of course I went out.
How's
I had the
that
best
fun?
time in my life there.
In Miami. Miami's. Have you been to Miami?
I've never been.
it's a
I mean, I
very
just
cool
turned
place.
21. I just turned
I
21.
love
So.
Miami. Miami is wonderful. It has, it's like a little country on its own. It's just so different from everywhere else.
Well, I mean, so you did party in Miami, but
Of course.
now because of COVID and because you're pregnant, you really can't go out and party anymore. So how far along are you?
I'm 35 weeks, and yes, I became a pretty boring.
Okay, I got a question, right?
Yeah.
For what is 35 weeks in the term of months?
So,
That's about
8 months.
8 months.
Close to-
Okay, okay.
Close to 8 months.
Yeah.
Okay.
I have a big belly. That's what it means.
And 9 months is the deadline. So just to remind you there, she's pretty close. Yeah.
yeah, that's actually pretty crazy. Like, just the whole concept of pregnancy, just like, as a man, I don't understand it. Like, I just like I don't even want to understand it. It's scary. I actually missed that part of sex ed in high school. Yeah, like my teacher's like, "Do you want to go do this project?" I'm like, "Yes, I'm out." But the big question is about COVID vaccines, right? And that's why we brought you here. You're an infectious disease specialist. You want to kind of go over what an infectious disease specialist is?
Yes, so you have to go through internal medicine training, and then you specialize in treating all sorts of infections that are usually diseases that are caused by either bacteria, viruses, parasites, or fungal infections. So all sorts of bugs we like to treat.
So COVID-19 infection. We know that Dr. Fauci
Yes.
is an infectious disease specialist, right? And so how was your training kind of built you up for this moment that we're facing here today?
Yeah, so I think that any infectious disease specialist has a very focused training on public health, which is one of the areas that we learn a lot about, how to control diseases, pandemics, epidemics when they get out of control. And of course, you take tracks in your career, and Dr. Fauci certainly took the track of what we call basic research and kind of finding cures for things, and he worked on HIV for a long time. In my case, my track has been taking care of patients, but we always stay in touch through the Medical Society, which is the Infectious Disease Society of America. And we all have to go through research projects. We have to publish things that we find during our training. We have to stay in touch with like recertifications on all the different tracks that there is. So I think that in this pandemic, talking to infectious disease doctors is key to understand like the underlying issues in the community that make this a public health emergency.
And I think we want to talk a little about some of those underlying issues that COVID has brought forth. And Yvette, you had a chance to look at some of the numbers recently, so like kind of paint the picture of what does COVID look like?
They're just the numbers are crazy. We're looking at about 56,687 cases just in Kern County as of this morning, and 479 deaths. 3 new deaths reported this morning at 10 a.m. We have experienced some of the deadliest days in American history because of COVID-19. And
that surpasses Pearl Harbor, 9/11. The deadliest day in American history was related to the coronavirus, correct?
Yeah. So we're looking at some really astonishing numbers. And I mean, why are we? I mean, you're an infectious disease, I guess, expert. So, why is it that this is such an infectious disease? Why is it that we're seeing so many deaths, even here locally?
So this is certainly a very particular virus, right? We know that for most viruses, you become infected, and once you develop symptoms is when you spread the disease. But with COVID-19, we've learned that it spreads really fast and really effectively even before you develop symptoms. So that's why the community spread has been pretty much the main issue with it. And once you get it, it behaves like many different types of conditions. So it behaves like an infection, but it also behaves like a clotting disease. It could behave like an autoimmune disease. It can behave like a cardiovascular disease. So all of those implications make it really serious when you get it and very unpredictable.
So, say if I have COVID, right, which I don't, just want to let you guys know. So when a patient comes in with symptoms, the doctor doesn't have a sheet like, oh, well, this is how we treat COVID. It's on a case by case because, like you said, it could be
cardiovascular. It can be all types of things.
Right. So let's start by saying that many viral infections, not all, but many viral infections don't even have a cure, right? So what do you do when you have a common cold? Because due to a virus, you stay home, you drink a lot of water, you take your grandma's soup, and you hope for the best, right?
Yeah.
Because there's no cure. So COVID-19 was no different, and we didn't have something that would kill the virus directly. So we started, trying things out. That's when all of these ideas of new drugs came out, and we did the best. But yes, so it's very unpredictable in the sense that you do have a group that is high risk, but it could do fatal things to healthy people as well. So it's really hard to predict who's going to die, who deserves the ICU.
So I think, and the other thing that we're looking at is that minorities and people of color, especially Latinos in Kern County, have been hit the hardest by this disease.
Yes.
And why is that?
Yeah, so to give you an idea of our current situation, I would say that the worst months of the pandemic were probably, February, March, April. And the worst day of that pandemic in California, we saw probably 12,000 cases, give or take. Now, today, on December 16th, we saw close to 60,000 cases.
Wow.
Wow.
So we are going through the worst peak in the whole pandemic right now. And we are seeing that the ICUs, at least in the San Joaquin Valley, are mostly occupied by Latino farm workers, field workers, and African Americans. And it's really hard to pinpoint an exact reason why that's happening. We could argue that these families live in smaller houses and are crowded.
Mhm.
Their families are big. Sometimes you see 2-3 families living together. They're crowded at work. They're crowded where they go out. They're crowded, at family members' house, in their own houses. So, the social distancing has been an issue with them. And of course, we all know that in the United States, there's healthcare disparities that we're all working on. And these populations that are vulnerable tend to have worse outcomes in many different diseases. So, we think those are contributing factors.
So Dr. Franco, you've kind of set the scene for us. I mean, people have asked questions. Is this an experiment? I mean, this is not an experiment, right? And I mean, it's just, to me, it's just shocking that people would think that, right?
Right.
I've seen people who have gotten COVID. I know people who have lost their lives to that because of this. So this is very real. And you've just told us about some of the deadliest days in America. People always ask the question, what is the way out of this pandemic?
So I think that for any expert right now, it's impossible to say the way out of this pandemic is this, right? But I do hope that through the vaccine, we see the most effective way to control the community spread. And if a good percentage of the community receives the vaccine, that means that the community spread is going to decrease significantly, and that's when we would probably see a control of the pandemic. By no means I'm saying this is the solution or the 100% thing it's going to make it go away, but it's certainly going to decrease this community spread, which will lead to more flexibility when going out, ICU capacity moving forward, and all of that.
You know what's so I want to go back a little bit, right? You
Yes.
talked about a lot of viral disease and infections don't actually have a cure. And I think that's like a big statement, right? So
Yes.
a lot of people think, like you said, the common cold, hey, I go get Dayquil, NyQuil, whatever, it's a cure.
No. Exactly.
And same thing with this vaccine, correct? It's not a cure.
It's not a cure. Vaccines are prevention. So vaccines are useful before you get the viral infection. Cure would be you have the infection, let me kill it and make it completely go away, which is really hard in the case of viruses.
And I got another follow-up question for that, right? I had a person, we ran a poll on Facebook to see who kind of was going to take the vaccine or not. The numbers weren't really that great, I'm going
Right.
to be honest. And one of the persons said no, but not for most reasons, like we talked about, like the conspiracy theories and stuff. He said, I've already gotten COVID, and I want to know if I need to take the vaccine, if I've already gotten COVID.
Right. So I understand that belief. The premise in infectious diseases is that you get it, your body mounts a response to it and a memory against it, and the second time you're exposed to it, your body will kill it, right? And that does happen in a lot of different infectious diseases. However, in COVID, we have not been able to prove if that happens to everyone, and if it happens, for how long will it last?
Okay.
So we do see in developed countries and European studies where they see that the person got reinfected by the same strain that they had 3-4 months ago. So reinfections do happen, which suggests that immunity is not complete when you get the infection. So yes, you could get it again.
So you're advising people take the vaccine, even though you've already had COVID.
Right, absolutely. And there was a question of should we prioritize these people or should we probably delay the vaccination in these people? And in general, medical societies have said, let's treat them as everyone else. regardless if you had COVID or not in the past, you should get the vaccine.
Okay. Okay.
So, question for you. We saw the first vaccine be given here in Kern County yesterday.
Yes.
It was an infectious disease
It was
expert
Dr. Haydari. He's one of the infectious disease doctors at Kern Medical.
at Kern Medical, right? And we actually have we have a pretty good a strong group of infectious disease experts here because of Valley Fever, right?
Right.
So the question I had for you is, when you saw, as a doctor, somebody who's been working on the front lines, you've been experiencing this every single day, seeing folks come in with the infections, having to advise them, probably console a lot of folks. When you saw Dr. what was his name again? Haydari, yeah. When you saw him get the vaccine yesterday, how did that make you feel as somebody who works in the medical field right now?
It's, on one hand, it's very exciting to see this happening in front of your eyes. Actually, for doctors, it's kind of historic what we're living and going through. It's to me, it's just amazing how science can advance in certain ways and protect the communities. And then on the other hand, it's hope. It's 100% hope that finally we're getting something that it's not only going to protect our doctors and nurses that are getting sick every day, but also are going to protect our patients, and we might see people living and not dying anymore.
And I know you're pregnant right now, and they haven't ran the trials on pregnant women, but when you are able to, are you going to take the vaccine?
Absolutely, yes. So I am pregnant, and recently the CDC said that because they didn't include any pregnant females in the studies, there's no data, right? But understanding what the vaccine is, what it contains, and what it does, the CDC says it's a risk-benefit conversation. You should decide if you want to take it. So the CDC kind of left it up to us, pregnant females, to decide. And as a pregnant female, I am absolutely going to get it. I don't anticipate any type of reaction, and I think my personal opinion is that all pregnant females should get it.
So in that response you just said, right? You said based off what vaccines do.
Right.
Could you kind of clarify what is in this vaccine kind of so that people will understand? Because there's a lot of I want to say Facebook posts that say certain things.
And we're getting some right now. People
Yeah.
are asking some questions. They're getting mad that we're
Yes.
not asking the questions. We're not going to ask the question because they're
Right.
these are based in conspiracy. But you're a scientist. You're a doctor. You specialize in this. Like Bob said, what is in this vaccine?
Yeah. So if you give me a minute, I'm gonna try and put it as basic as I can, because I think this is the most important question of all. What is in this vaccine and how does it work? So let's start by saying that all vaccines are different. There's tons of different types of vaccines. So let's talk about this one. It's new technology. We don't have vaccines like this one. We haven't had them in the past. So to understand what it is, I'm going to compare the human body to a bakery, right?
Okay.
I like bread.
you like bread. So you go to this bakery that has unique bread. You love it. It's only unique to that bakery. And that bakery has a book of recipes, and then the chef goes and takes each recipe and makes the bread, and at the end of the day, you have all these breads that are unique to that bakery. So the human body is its own bakery. I'm made out of proteins of all sorts of forms and sizes. And the recipe for each protein is stored in my DNA, right?
Mm-hmm.
So my chef or the cooks are a molecule called the ribosome. So that molecule goes into the DNA or takes the each recipe from the DNA that comes out as a message, right? A recipe is a message. That's why it's called messenger RNA, right? So that recipe, the ribosome takes it, makes the protein, and then the protein goes and does whatever it does. So let's say that I'm giving you a recipe for a donut, but your bakery doesn't make donuts. So as soon as you take this recipe and make follow the instructions, you're going to have a donut. And everyone in the bakery is going to say, this doesn't belong here. Let's throw the donut away. So it's the same principle. What the vaccine contains is the recipe for a protein found in the wall of the COVID-19 virus. So when your ribosome, who is your chef, takes that and makes the protein, as soon as it's made, they say, oh, wait a minute, this is not mine. And the ribosome is going to call all the immune system, which are kind of your soldiers,
And push it out.
that it's going to come to your shoulder where you got it injected, and are going to create a chaos and war and kill it. And then they're going to mount a response and memorize that protein. And if I ever see a donut again,
Uh-huh.
I'm going to kill the damn donut.
Nice.
Yeah.
Right.
Right?
So we
See-
don't like donuts.
Not only is she a great infectious disease specialist, she's helping me with my diet. I need to kill those donuts. No more donuts for me, right?
Yvette, you had a question.
Yeah. So is it true that the virus is introduced to the body through the vaccine?
So no, the what it's introduced is simply the message. It's the recipe. It's just a message to make the protein. You don't get the virus introduced. You don't get a protein directly introduced, and the protein that your body is going to make has no power to create any form of disease. So viruses are made of many proteins as well, and there's a protein that's the angry one that's going to cause a disease, but there's some other proteins that are just a wall protein, like structure. So this is a structure protein that has no ability to cause disease.
Got it.
So, Dr. Franco, we have we're on Facebook Live right now. Some people are asking some questions. This question
Yes.
comes from Ulysses Hernandez, and he says, "My question is for Dr. Franco. Let's say we were to take the vaccine and discover that there are some side effects.
So
We know that there are side effects, and here's the question: How sure are you that the COVID-19 vaccine? How sure are you about the COVID-19 vaccine? And is it imperative that we still have to wear a mask?"
Okay, so to answer the question in different points. First of all, side effects, yes, with everything we take, right? Any vaccine, not only the COVID vaccine, could give you some side effects. Alcohol give you side effects. Diet pills gives you side effects, right?
Even a basic Tylenol or an ibuprofen can give you a side
Exactly.
effect, right?
You know, the green herbal tea that you drink has side effects. So it's important that you ask these questions and know what the side effects are so that you can expect them and don't freak out. So what are the side effects? You get in the injection site, as I said, there's going to be inflammation. There's going to be all these cells acting upon the protein. So you're going to have a little bit of inflammation, a little bit of soreness in the injection site, maybe some redness. And yes, your body is reacting to a virus or a protein, so it's activated. So you might get a little fever, a little headache, a little nausea, a little diarrhea. But all of those are side effects that are expected and yes, could happen in many people. It doesn't mean that you're allergic. It doesn't mean that you are negatively reacting to the vaccine. Now, the other question Ulysses asked was, is it safe? And I think that we can expand on that. But I think that the research that we have so far, clinical trials that already have been reviewed by people that are experts that have nothing to do with the pharmaceutical companies and already have been reviewed by FDA, CDC, and all that, gives us enough reasons to believe the vaccine is safe and that up until now we haven't seen any major complications with it. And I would say after the vaccine, yes, wear a mask. Why? Because we are in the flu season and the vaccine is only going to protect you against the COVID. So we need to protect the community against the flu and against other common colds. So I would say yes, still wear a mask. And because you don't know if other people are getting the vaccine, so you still want to protect your community. So social distancing, hand washing, and mask should still be going on.
Somebody asked a question about what about the false HIV positives it can cause. Have you heard anything about that? I've never heard this before, but maybe.
So I have not,
Okay.
but what
And
happens?
you head up the HIV project at Clínica Sierra Vista, correct?
Yes.
Okay.
So-
So you're well informed on this issue.
Yes, so I'm an HIV doctor over there. So what happens with HIV testing is that it's very similar to COVID. So to begin with, HIV and COVID, separate different things, nothing to do one with the other. But HIV tests can be false positives for many reasons. So for example, during pregnancy, proteins from your placenta could make you have a false positive HIV test. Or if
Wow.
you have syphilis, it could cross-react and maybe cause it to have an HIV positive test, false positive. Certain autoimmune conditions like rheumatoid arthritis or lupus could probably put you at risk for having a false positive HIV test. So have we proven that the vaccine gives you a false positive test? No, but could there be an association? Yes. There is an easy way to confirm if an HIV positive test is true versus is false. Yes. So I would say that if you get the vaccine and you have a false positive HIV test, the way to go is go to your doctor and have the confirmatory test and that's going to be negative.
So there's some questions about the speed of this vaccine that was developed. And I think, Bob, how much time we got here?
We got about 2 minutes.
About 2 minutes. So we want to wrap it up here. But the speed of the vaccine and how it's created. I personally think that this is because we have modern technology and we put the weight of the whole world behind this because we want to stop this pandemic. What do you have to say with people who are saying, well, it was created too fast?
So I understand why they would say that, but I would debate that it was actually too fast. It's been a year, which is not fast in the setting of a pandemic. But what we need to know is that the technology to develop the messenger RNA already existed. So we didn't have to create a new technology. We used what already existed for other purposes, and we used it for the vaccine. So the only thing we had to create was that little messenger RNA, and then figure out the protein that we wanted to create. And then in this whole year, what we've seen is clinical trials. People have been testing this vaccine in thousands, and I think close to 30,000 volunteers in the case of the Pfizer vaccine. So recruitment of a lot of people really tell us that it's safe. So we can be comfortable knowing that the time frame, of course, has been a little shorter than before, but it still gives us the data we need to know that the vaccine is safe.
Very cool.
You know what? This whole discussion with you has been not only insightful but incredible, right? I think a lot of people are nervous, but one thing mantra I kind of live by, right, is am I smarter than the experts? No.
It's like when your car's broken, do you go to a mechanic or do you try to fix it yourself?
Exactly.
Most people go to a mechanic, right? So, I'm not going to, I think you're getting at the same point, Bob.
Exactly, in that sense. But Dr. Alexandra Franco, right, the infectious disease specialist, and she works at Clinica Sierra Vista. Thank you so much for your time.
No, thank you for having me.
And also thank you for all that you're doing. We know that right now you frontline medical workers are kind of getting overlooked. And we just want to thank you from all of us here at Forge and at the Chavez Foundation for the things that you do on a daily basis to keep our community safe. And to make sure that we're getting accurate and real information out there.
And thank you for having me. I think the spaces in which we can explain to the community what the vaccine is and to say it's safe are very important in an area of uncertainty and misinformation. So thank you for inviting me.
Yeah, thank you so much. I mean, the amount of information that I just got right now is just amazing. I know that Bob and I are probably going to talk about it later. We finally know what an infectious disease specialist does. So thank you so much.
Exactly. And thank you to all the people on Facebook Live who are watching and sending us questions. And if you are on FM, stay tuned because we have the feed and a spicy words of wisdom coming up on Forge 103.9, a new sound.